Dr. Levine, do you believe that minors are capable of making such a life-changing decision as changing one's sex?
Can a man be a woman?
Trans teen phenomenon.
Gender identity is completely separate from sex.
Long before they're ready psychologically or emotionally,
I feel like a woman, therefore I am a woman.
and walk out the same day with a prescription for testosterone without her parents' permission.
A lot has been said about how easy and accessible transgender medical procedures have become to children in our country. But not a lot of people have talked about what exactly that process is and how those procedures are done. In the United States of America, healthcare as a whole wildly differs from state to state, with different rules and regulations regarding a person's ability to transition. But in general, there are roughly 4 major steps a person can take in this process to medically transition. The first step would be a mental health evaluation with a doctor or a therapist who has studied these types of issues regarding gender. What these doctors are looking for are a confirmation that the patient has gender dysphoria, and they are trying to gauge their patient's understanding of what it is that's going on, trying to solidify informed consent, really. Prior to this, the most a child can really do to transition is socially, cutting their hair, changing their name, wearing different clothes. The second step will start around the age of 10 to 14. It is the first step. Anything strictly medical can happen, that being puberty blockers. So it's important to note that puberty blockers don't actually change a person's body. They just put a pause on puberty, whether it be prior to starting or after. It just pauses it. It is totally reversible. A patient can stop taking it and their body will resume normal puberty function, as it would have otherwise. Patients can only take blockers so long as they show long-lasting or intense patterns of gender dysphoria, or their dysphoria began or worsened at the start of puberty. Step 3 is where the more permanent steps begin, starting with hormone replacement therapy, or HRT. Some clinics may require referral from a mental health professional, but not all of them necessarily do. Again, it is still possible to stop HRT, and your body will essentially just pause where it's at, in whatever stage of change it's at. HRT requires a patient to be at least 16 in most states. Oregon is the lowest in the country at 15. But this age of consent for medical procedures applies to all medical treatments, not just a transition. The final step for a full medical transition is surgery. Though about 75% of people who do the first 2 steps do not go on to surgery. Patients must also be over the age of 18 or have permission from both their parents and mental health professionals. Most doctors will also require that the patient has been on hormone therapies for at least 12 months, as well as having lived another 12 months as their preferred gender, as well as referrals from at least 1 or more mental health professionals. Usually they require at least 2. These surgeries can cost anywhere from $7,000 to $25,000 depending on your location as well as the type of surgery you are getting. And many insurance companies do not cover all parts of a person's transition, meaning most of this is out of pocket. And the ability of a person to find doctors who will perform these procedures can be limited by location, making hasty and unnecessary gender transition rare and nearly impossible. Children cannot undergo surgeries and hormone therapies because they haven't developed enough of their body for any of these procedures to really do anything that won't be undone later by puberty. Most teenagers also do not have access to the time and the money required to transition quickly, quietly, and behind their parents' back. So I think it is worth asking, what is everyone talking about when they argue about these hasty gender transitions that go completely behind a parent's back? These transitions are expensive and they take a long time. Who's getting cheap transitions done in less than a year?